Hello and welcome to this special interview. I'm Shubham Thakur, and today I have with me very special guests on the show, actress Huma Quraishi and CEO of Save the Children NGO, Mr. Sudarshan, if I'm not wrong. Sir, can you please take us through this whole project of 100 million children for which Huma and you both are collaborating for fundraising to save them who are affected by the COVID-19?
First of all, I wish it was 100 million. It's 1 million,
Oh, sorry, my bad.
and
100.
no,
Yeah.
no, perfectly all right. I mean, like I said, I wish it was 100 million. It was like till every last child, whatever it takes, is what we dream of.
Mhm.
1 million is actually very symbolic. I would say it's like a drop in the ocean,
Mhm.
and yet it is more about here and now. We are living through this crisis, and we wanted to respond to it, and we wanted to respond to it in a manner in which we find a method for a larger context. So I would say in one way it's a drop in the ocean. On the other side, it's actually there's a whole ocean in this drop. And the idea is to, for us to collaborate and contribute in a way. I mean, what we believe is that there's none of us is an island where we can say I am okay and I will do everything for myself and I will take care and survive. So we recognize this context that me, Huma, the government, the local administration, the civil society, the community, the person, the primary stakeholder, all of us have our little parts to play. Some of us do it willingly, some with a little help, some with a little nudge. And I want to put on record here that one of the things I very deeply appreciate, Homa, is that you reached out and poked us into getting through this action. So conscience, let's say active citizenship, this is what it is about. It's
Mhm.
not about who we are in a larger identity. It's about this proactiveness. So the idea with this 1 million children symbolically is to reach width, depth, and the spread of the country, engage in small pockets into creating a method and a process. So
Mhm.
if you would see some of the processes, say 100-bedded hospital in Delhi, I think it does injustice to Huma. It's not that physical structure that we are partnering about. It's about engaging with a community. There's been a conscious effort on her part to say, I come from here, let's together partner to go
Yeah.
back, create a process, engage with community to know about this issue, to know and be aware and knowledgeable about healthcare, to make sure they seek out the healthcare.
Yeah.
So, and then to say that when they seek out, there is a facility which can respond and cope up to it. And then the larger idea is that children, who are our primary concern, they don't live in isolation. They're caregivers and their community. And when you come from poorest quarters, like today we faced, this Zoom link, whatever can go wrong goes wrong. Technology also it happens, but in poorer quarters, it's about life tomorrow, survival. And so parents being sick, okay, do they have health care? If they're getting health care and these parents are surviving on day-to-day livelihood, who's going to feed children? What's going to happen? Who's
Mhm.
going to take care of? We may decide, some expert may say quarantine. Do they live in spaces where they can afford exclusive self quarantine? How do we help them with those spaces? How do we ensure safety, security? So this 1 million children, Shivam, is beyond a number and beyond a facility. It's about a process. It's about engagement, respect, and I mean, Uma, for you, I would say it is active citizenship.
Yeah.
That's what it is. We are saying that we are a part of problem and sorry, part of the solution. That was a Freudian slip, and not a problem. So here we are, Shivam.
Okay. If I can ask you, Huma, what motivated you and prompted you to collaborate with the NGO and go out of your way to help those children affected by COVID-19 pandemic? Like in all terms, what has motivated you?
I think just what has been happening, the
Mm-hmm.
past, of course, in the middle of the dreaded second wave, and I have been also personally affected by it as much as
Mm-hmm.
anybody else. And just sitting at home, feeling the utter sheer helplessness that one feels in a situation like this. And also, my best friend, some very close people to me, fell sick, and you really realize that you just refuse to sit at home and be like, yeah, I can't sit at home and do nothing about it, and which is what I think Sudarshan is trying to say, when I reached out, because I have been associated in a very small capacity with Save the Children over this last 1 year, whether it was a telethon or I had made a trip with, some of the trustees from Save the Children to Nepal, where I actually saw on ground the work that was happening with my own eyes and the impact it was making. Often we all donate and we all like to do, some kind of charity work, but we never really know how it is really impacting the lives of these children, impacting the lives of people, As so when I actually got to see that with my own eyes and got to experience that, I was really, really moved. So when this entire thing happened, I remember all of us were talking on the phone or expressing anger or helplessness on social media. So for me, it became a very, very immediate concern. Some of my family friends, people I've grown up with, my dad's friends, how all of us were left scrambling for basic amenities, beds, medicines, the usual. And of course, then the conversation started with Sudarshan and his team, Madhura and Pragya, that what can we do about it? Of course, one important thing is to figure out, and through child helplines, reach out to the children, either who themselves or their parents have been affected by COVID. Where do these kids go? How do we stop, say, for example, all the illegal and unlawful adoptions from happening? How do you prevent these kids from, ending up in trafficking? So these are very, very big and larger and grave concerns. But of course, like Sudarshan rightly said, right now, our focus is to save lives, is to save families and communities from breaking down. And which is why we all started these conversations. I started educating myself about, with my interaction with Save the Children, as to how because we all want to do good, right? But humko samajh nahi aata ki which direction we should go in.
Yeah.
Which is when the idea of the 100-bed hospital and the oxygen plant came forth. And I think, it's I guess all of us trying to do a small bit, and all of us trying to make a difference in the way that we can, and if I always believe, if I'm an actor and maybe, even 10 people follow me, if I can use that voice to sort of bring about a positive impact to society, especially in a time like this, where India is possibly going through the worst kind of crisis ever, I would not be able to live with my conscience. So, I have to, it just felt like a very immediate thing that one needed to do. And I really feel like this is not enough, and the more you discover it and the more I'm engaging with the on-ground team in terms of, just the specifics of what this is going to happen and how dynamic the situation is on ground, and how quickly and how fast it's changing. You realize the magnitude of the work that you've taken upon your shoulders. And, hats off to Save the Children, Sudarshan, his whole team, because this is what they do. This is what they have been doing. I've been involved at a point in time right now, but this is what the services they've been offering, for the longest time ever. So really hats off to you, sir. It's really, really commendable.
How, if I can ask you, how has the response been so far on this project of the public?
It's honestly, the pandemic has shown us some horror stories and has shown us all these grave images, which have been very, very heartbreaking and painful, and raises some very, very pertinent questions. But I feel like on a personal level, it's also made me see a lot of good in human beings. There's so many people who have come forward who I didn't expect, and they have been so generous and so kind with their words. They've been so generous monetarily, and they've come forward and they have contributed very, very, generously is the word that I keep saying, because there's so much gratitude I have. We're already close to the 50% mark on this project, and already I think work has started on it. This week we will be, I guess, rolling out a whole lot of things that we start procuring and starting providing for this hospital facility. So that gives me a lot of hope. We started a week ago, Sudarshan?
Yeah.
We started a week ago, and we almost hit that, which is, because I was a little scared before taking this project, because I was like, everybody is trying to donate. I've never done something like this. What if I'm not able to keep up to this promise? What if we fail? I can't. So I had all these doubts, but I guess I remember talking to, I think Madhura it was.
Yeah.
And she was like, Huma, just start. It'll find a way. Life will find a way. And I think that's the approach we took. And we are still like talking to so many people, whether they're individuals and, organizations, they all have come forward. Whether it's been real estate, whether it's been people from the film fraternity, so many actors, actresses, producers, they all have come forth and have really been so generous, and so positive. And they've all said the same thing. We're doing this right now. If you need anything else, please just pick up the phone and call us. And that has been such a good feeling. There's so many of my friends, I sent everybody a message saying, hey, guys, I'm doing this. And I didn't get a reply back. So I thought, okay, maybe they're not interested. And they have just quietly gone and donated so generously. And that made me feel so grateful. I'm like, मतलब अच्छाई भी है दुनिया में, लोग अच्छा काम भी करते हैं, कभी कभी उस अच्छे काम के लिए शायद वो सामने भी नहीं आना चाहते. They want to do it quietly, and that makes you so hopeful that there is a better tomorrow, that there is love and there is a lot of
Particularly amid
positivity
these times.
in the world.
Yeah.
Absolutely gives me a lot of hope, especially in these dark times.
So, sir, coming back to you, like there have been several reports in the media that several children, they have lost their parents. Like now there is no one to look after them. There is also report that children are not able to express themselves, and they are the ones affected the most because they have to be restricted to the four walls of the house. You can't talk when there is a time to interact in the school. You are just in your home. How do you plan to help children in terms of those areas? How do you plan to help those children?
Shivam, I'm a father of two kids. I mean, of course, they are both grown up now. So I'm speaking this also from something very personal and as a context and from a comprehension. What I'm afraid of is what are we not knowing? This in this days of what we called as social distancing, where I don't tire by telling people that it's not social, but it's physical distancing. Socially, we need to be far more connected now. So in this time, there is a paucity of data, of first-hand information from ground and everything. And therefore, whatever we are sharing and seeing is more from our estimations and approximations. And daily the number of deaths indicate an increasing number of children have lost their immediate caregiver, guardian or families. And there is a validation by surge and SOS calls that have been coming in media, that and various forums, social media, elsewhere, about children in distress, reaching out our helpline and other contact, that this is definitely on a rise. And when I look back at our own experience of the years, there is a substantial rise in abandonment, traffic, and abusing around any such disasters. And when I say this, I'm not saying that it's an intentional, easy statement that people do. We are talking about the bottom of pyramid, the most vulnerable of people whose existential issues overtake on a day-to-day basis. So there has been a pattern in this. In this pandemic, beyond this pattern, the social fabric has come to test. I mean, if you imagine a slum or a little village, compact people have 50% or less information or a lot of disinformation around this, and you prescribe, let's say, a quarantine or seclusion. I mean, people are panicking. The same people who were lifeline to each other and could hold back of each other actually are wary. So if the parents have been hospitalized, who takes care of the kid? How do you reach out? If they all have a common toilet, bathroom, hygiene facilities, what do they do? I mean, where do they stop? So there has been that part of the feeling also, and we see this as happening. In terms of child protection issues on ground, we've kind of adopted a comprehensive action plan where we've also not just saying that we will do it ourselves. We've brought in all other child rights organizations, the community institutions and others to all come together. There is also the helpline which we have activated, the 1098 number, and the child protection one, which is a 1800 121 2830. Then all other numbers have, and more than anything, I mean, these are all existing. But what we are doing more than that is ensuring that uh, all this is known to everybody and it is utilized and it is brought to practice and it works, because systems are also rusted when they are not worked fully. So the oiling, uh, more than all that, we've also deployed a few doctors and a few counselors to be available 24/7. And this I'm speaking from very personal experience. From my memory goes from 1984 Delhi onwards, that when, whether man-made or any kind of context strikes, people there are a lot of people who just need somebody to listen to them. So you asked me about the mental health, mental well-being. So it's not like there is, people are able to define it कि ये मेरे को ये मुश्किल है, या this is what is going on.
Basically, you want the
They are,
conversation to start on this whole matter.
yeah, yeah. I mean, people just need to have a reassurance that somebody is listening in, caring. I myself kind of on a daily basis, 3-4 hours, I just keep calling random people from my own team frontline, and through them the children and other, and just strike a conversation.
Yeah.
And and there are all those who are on the silent margins, who don't even reach out, or if you reach out they find. So mental health today of our frontline workers, of the caregivers of children, and the children themselves. My daughter, 20, has always been an outward looking person, outwardly person, outdoors person. Last 1.5 year, either by her choice or by panic of parents or grandparents, she's confined into a room, into a
And the
place
problem is
away
that
from
children can't
everybody.
even
And
express
this is
it. They have no way to interact.
they
Like,
can't.
yeah, they can't even
Yeah,
express
and
it that
this
they
is
are
a
alone.
privileged child,
Mhm.
yeah, who has a space. We are talking about children for whom going to school, playing in open air or ground were the only form of recreation and satisfaction, and open social interface.
Yeah.
4 kids, parents, grandparents, everybody locked into one. So it's playing havoc in their mind. And like I said, Shivam, what scares me is what I'm not hearing.
Yeah.
Rural hinterlands. People
Yeah.
are yet to come to terms with whether it is COVID or not. Testing, other. So, so the children of future, I think now is the time to engage, and no
Yeah.
quantum of engagement is enough engagement in terms of either resources or our health context or psychological this thing.
Mhm.
I mean, they need to be spoiled. They need to know that people are caring for them, and that they are not left alone.
So,
And
Huma,
that's the thing. Yeah.
coming back to you. So, you also tweeted a few days ago. You tweeted a few days ago that around 165 million children are affected because of the COVID-19 pandemic, and reports say that in third wave of the pandemic, they will be the most vulnerable. So the question is, do you think the government, not just the central government, but respective state governments, they are working or planning towards, protecting children, particularly in the third wave? Not to say that they should not protect now, but they're going to be affected the most.
I certainly hope so. And I know that a lot of work is happening. Say, for example, see, there's always the most vulnerable that are most effective in a pandemic like situation, in
Exactly.
any conflict, actually. And there are enough studies and reports to talk
Mhm.
about that. So I think definitely the kids have been affected. Of course, like Sudarshan rightly said, the privileged kids have different issues like mental health being an important one, access to going to play, or the fact that suddenly 2 years almost of their lives, of going to school or college,
Mhm.
etc., has been completely snatched away. So that, of course, will have a psychological, sociological effect on them. But of course, there's also a question of, say, for example, access to healthcare in so many cases, or access to medicines, resources, everything.
Exactly.
I know I was way before Save, I was helping, somebody trying to, get a hospital bed, a pregnant mother. So I'm saying starting from that point onwards to basic early child healthcare to much later also, these are all issues and concerns that we have to talk about. Of course, there's several reports right now talking about, third wave affecting children the most. So what is the plan for vaccination? What is the plan for their care? The building where I live in, about 12 kids over here, and they all have stopped coming out and playing in the evening. They all have stopped coming to cycle. Earlier, you couldn't in the evening. My building used to be like chup ho jao, stop like making too much noise. And now you miss it. You want those kids to come out. You want them to play. You want them to break someone's glass. You want them to play cricket. You miss all those things. And I feel it's so tragic that they can't go to schools. They're missing birthdays. They're missing all those little celebrations that make childhood. That make childhood important. And that is like, I wish I'm in a way I'm glad, like, that I mean I'm done with my childhood. Imagine if I were, in school and to have to like miss out on, like, I don't know, farewells and for your best friend's birthdays, and not being just basic things, like that. So I feel it's sad. I know, like, say for example, Tilak Nagar hospital that we are working on, there is a conversation to have a child and a pediatric unit over there. So we are actually working on that and the specifics of that. I think Sudarshan can take you over it because I always say I'm not a
Yeah,
technical
yeah.
person, nor am I a doctor, so I can't and I wouldn't want to comment on that in case I end up spreading any kind of misinformation. So I leave it to the experts. I
Mhm.
think my role is to just, I guess, tell people about the gravity of the situation for them to come forward and to whatever it could be. I'm saying you don't have to donate to a charity, you don't have to go out and do anything. Just pick up the phone and talk to somebody. It could be you ordering groceries for an elderly person in your this thing, or just picking up the phone and checking up on somebody.
So I
Yes,
was asking,
Yeah.
are you collaborating and trying to start a conversation on the whole matter itself? Is it because the children are neglected most? Is that the reason that you have been collaborating, speaking up on this matter? Like you want an issue to be talked about.
absolutely,
Mm-hmm.
absolutely. That's the whole idea behind it. It is an
Mm-hmm.
issue, it is an important issue. And children are our future. आप उन पे ध्यान नहीं दोगे तो मतलब then everything is lost. We always have talk about that, and they are child rights is something that should be our focus any which way, irrespective.
Mm-hmm.
But having said that, especially in a time like this, we have to really think about what are the steps we're going to take at the government level, at a personal level, and society level, and what are we going to do about it. So that conversation is very, very important.
The last question to you, sir. What are the major challenges, if you can just tell us in a very short, like 1 minute, what are the major challenges that you are facing in terms of ensuring all kinds of help, protection to children affected, especially by COVID and those who have been abandoned, as you told?
First and foremost challenge is inadequate information
Mm-hmm.
and a very serious time lag between a situation happening somewhere and us getting to know. And because the sources and this thing, so like I'm remembering a story of two children in Kolkata, in one of the rural in the hinterlands, 24 hours remaining unattended because the situation didn't come to information even to the immediate community
Yeah,
after their parents were lost to the COVID. So the lag time is a big challenge. Information flow, awareness of community and ownership, that these are things which can be worked around with. It is not like this is the doomsday or the last thing. It's just that if we are aware, we can protect and we can work around and still not just protect ourselves but protect all the people whom we care. Biggest challenges, psychosocial support, like I said, as to what is going on in the head of children confined to those spaces. Like I said, I mean, the bottom of the pyramid for a child living in a very limited confined place, every day was a bright day when there was a school and there was a interface with other children, playing space, not to say the least the midday meals nutrition contribution, which was almost 50% of their quality intake, and then the free play social contact, all that avoided, and to be inside and confined is the biggest challenge. How to help? Last biggest challenge is making the entire machinery well oiled and worked repeatedly so that minimal time each child has a safe, appropriate caregiving, that they are not exploited and they are not risked, and they are offered. These are the biggest challenges. It's not about resources. Like Uma
okay.
said, she's been and we've been pleasantly surprised with how many people back that. So resources are welcome and more are welcome, but affirmative action in engagement.
So can I ask you just two quick questions?
Yeah.
Uh, what is the number of children that you have been able to reach out through this campaign so far?
Okay. Okay. So far, so like I said, the target was 1 million.
Mhm.
And so far, actually, we've been in various forms and ways have reached close to 500,000 children already.
Okay.
And I would say in hundreds in terms of children who've been rescued, provided shelter or caregiving,
Mhm.
nutrition a far wider, and education and health a still wider context, because it's not about just COVID in COVID. It's with
Okay.
COVID, everything else around a child's life, which is
Mhm.
breaking apart.
Mhm.
So that entire engaging and all this, Shivam, unfortunately, it's just a drop in the ocean.
Yeah, yeah. So this project,
Hmm.
will this just be limited to Delhi or will it be done in some other states also? Like, do you have such plans also?
I think we do want it to grow, and we do want to take it to other states. We want to, but like, I mean, I remember our first conversation, Sudarshan, and we were all sitting and we went over like all the different states and all the work that Save the Children is doing. And literally at the end of the call, I felt so overwhelmed because I was like, there is so much to be done, and where do you even begin from? So I think our objective was to pick up one city, one project, and to be able to do that the way it should be done so that people are impacted, as opposed to just trying to do too many things and not being able to fulfill on anything. Okay. So I think we are starting off with this, and God willing, we will move to other states, other cities, other villages, and we will maybe be able to do this and replicate this once people see what the project that we have, the responsibility of that project we have taken upon ourselves, and be able to fulfill it correctly. I think that's our
okay.
Absolutely. Shubham, I would just like to build on what she said. Yeah. Getting the method right in one place and holistic. Yeah, holistic and method right. So replication will follow easily. And there are many takers for the replication. So that's the import of this particular collaboration.
Okay. Thank you so much, both of you, for spending time and talking to us. Thank you so much.
Thanks, Shivam.
Thank you.
Thank you.
Thank you.